boarding care home in Los Angeles County. You can see that news conference on www.mentalhealthhookup.org. Just click on advocacy and you can see the whole thing if you didn't get to see it. So that's exciting, guys. That is so awesome. That's the good news. What's the bad news? Because you know we got some. And the bad news is that we've been hearing about this $11 million that's both been coming in December, in January. It is, we have boarding care homes saying, I can only last until December 31st. If I don't have some relief by then, I gotta close. I don't wanna close, but I gotta close. So I polled a few boarding care operators before I wrote this talk and asked, have you gotten any new money? No, no, and no. Do you know when some is gonna come? No and no. Do you know what you need to do to apply for the money? No and no. So now we're almost to St. Patrick's Day, and we have facilities that were critically on the line, gotta close if we don't get some help by January 1. So there's the gap, and that's the downside. And y'all, we have to do something about that because we're gonna lose these facilities that serve such a vital function, and I won't go into what those functions are, except to say that we know, as Dr. Sharon mentioned, that when for some people, boarding care homes stabilize them and provides them with a container so that they can have a better quality life without the constant in and out and this disruption of having to start their lives all over again. Every time they go into a new hospital, they get sent to a new place and a new this and a new that. All of that is so disruptive and it's so inhumane, and more importantly, it's so expensive and it doesn't work. So why are we doing it? So we must rise up. We have to rise up now. We are almost there. If it was a football game, I think we're on the 15-yard line and we're going to score, but we have to keep up the pressure. All of you who want to see a raise, and just to be clear, I am not talking about enhanced mind health. I mean enhanced rates. That's what we have right now as a bridge. But what we really need and what I'm advocating for when I go to Sacramento and I go to other meetings statewide is an across-the-board raise for all licensed adult residential facilities and RCFEs. And when they ask me, how much do I want? Like, I have a facility. I don't know how much I want. I am a social worker by profession and a parent, member of NAMI. So the answer I give them, well, let's just start with mirroring the lowest level of pay that all of the regional center facilities get. That would be a huge increase for all of our facilities that take our kind of people. And then y'all can figure out a fancy tiered system and all of that. Y'all do that. But